Passing blood clot can be very concerning for young women. And this blood clot is formed when protein and blood comes together to stop bleeding. There are so many causes of blood clots, and I'll be listing them one after the other in this video. Number one is hormonal imbalance. Estrogen and progesterone can be fluctuating, and when these hormones are fluctuating, it will lead to heavy bleeding, and this heavy bleeding can lead to you having blood clots. Number two is menstrual disorder. Having heavy or irregular menstruation can lead to having heavy period. And when you're having heavy bleeding, it can also lead to having blood clots. Thirdly, is fibroid. Growth in your uterus can lead to having heavy bleeding. And when you're having heavy bleeding, you can still have blood clots. A cyst or polyp, that's growth in the uterine lining, can cause heavy bleeding. And fifth is adenomyosis. I don't know if I got the pronunciation. Uterine tissue growth into the uterine walls. That can also cause heavy bleeding. Sixth is thyroid disorder. That can also affect your menstrual cycle, and also PID infection. It can also affect your menstrual cycle and also cause you to have bleeding. Then lastly is medication side effects. Medication like birth control, blood thinners, or antidepressants can also cause you to have heavy bleeding. What are the symptoms of blood clot? One is prolonged bleeding, painful cramp, dark or thick period, and blood clots over 1 inch. If you're noticing all of this, please go and see your doctor.